Welcome to Fun Facts Online. Today we're talking about a drug that has dominated headlines for its effects on weight loss. But what if I told you that its most important legacy might have nothing to do with shedding pounds? What if this drug is quietly ushering in a new era of cardiovascular protection, saving people from heart attacks and strokes through mechanisms that scientists are only just beginning to understand? We're talking about semaglutide, known by brand names like Ozempic and Wegovy, and its journey from a diabetes treatment to a cardiovascular powerhouse is one of the most fascinating stories in modern medicine. Initially, semaglutide was developed to treat type 2 diabetes. It belongs to a class of drugs called GLP-1 receptor agonists. In simple terms, it mimics a natural hormone your gut releases after you eat. This tells your pancreas to produce more insulin, tells another hormone that raises blood sugar to stand down, and slows down your digestion. The result is better blood sugar control. But during clinical trials, a remarkable side effect emerged. Patients were losing significant amounts of weight because the drug also acts on the brain to reduce appetite and cravings. This led to its blockbuster approval for chronic weight management. The story could have ended there, but a crucial regulatory requirement changed everything. The U.S. Food and Drug Administration, the FDA, mandates that all new diabetes drugs must undergo trials to prove they don't harm the cardiovascular system. It was during these safety checks that something incredible was uncovered. An early trial, called SUSTAIN-6, not only confirmed semaglutide was safe for the heart, but hinted at something more. In high-risk diabetic patients, it actually showed a significant reduction in what doctors call MACE, or major adverse cardiovascular events. This is a combined measure of death from heart disease, non-fatal heart attacks, and non-fatal strokes. These early whispers of a cardiac benefit laid the groundwork for one of the most important clinical trials in recent memory. This brings us to the SELECT trial. The name stands for Semaglutide Effects on Cardiovascular Outcomes in People with Overweight or Obesity. This study was a true game changer because it was designed to answer one critical question: could semaglutide protect the heart in people who did not have diabetes? This would allow researchers to separate the drug's heart benefits from its effects on blood sugar. The scale of the SELECT trial was immense. It enrolled over 1,700 people aged 45 and older from 41 countries. All participants had existing cardiovascular disease and a BMI of 27 or higher, classifying them as overweight or obese, but again without diabetes. They were randomly given either a weekly 2.4 milligram injection of semaglutide or a placebo, on top of the standard care for their heart condition. The results, published in the New England Journal of Medicine, were profound. Over a period of about 3.5 years, patients taking semaglutide had a 20% lower risk of a major adverse cardiovascular event compared to those on placebo. Let's break that down. A 20% reduction in the combined risk of dying from a heart attack, having a non-fatal heart attack, or having a non-fatal stroke. The benefits didn't stop there. The semaglutide group saw a 28% reduction in heart attacks specifically, and a 19% lower risk of death from any cause. This is a massive impact. But here is the most striking finding from the entire study. The cardiovascular benefits were largely independent of the amount of weight lost. Yes, the patients on semaglutide lost an average of 9.4% of their body weight, which is significant. But a detailed analysis revealed this weight loss only accounted for a small fraction of the heart protection. Professor John Deanfield, a lead author of the analysis, put it this way: it is labeled as a weight loss jab, but its benefits for the heart are not directly related to the amount of weight lost. In fact, it is a drug that directly affects heart disease and other diseases of aging. This observation shifted the entire conversation. Semaglutide wasn't just a weight loss drug with a happy side effect, it was a cardiovascular drug in its own right. While the SELECT trial was making waves, another set of studies called the STEP-HFpEF program was delivering a beacon of hope for a different group of patients. These trials focused on people with a particularly challenging type of heart failure, called heart failure with preserved ejection fraction, or HFpEF. This condition is especially common in people with obesity. In HFpEF, the heart muscle contracts normally, but it becomes stiff and doesn't relax properly to fill with blood. This leads to debilitating symptoms like shortness of breath and extreme fatigue, and for a long time, we've had very few effective treatments. The STEP-HFpEF trials tested semaglutide in these patients, both with and without diabetes. The results were a breakthrough. Patients treated with semaglutide reported substantial improvements in their heart failure symptoms, their physical limitations, and their overall quality of life. They could walk significantly further in a 6-minute walk test, a key measure of exercise capacity. Crucially, like in the SELECT trial, the benefits seem to go beyond just weight loss. An echocardiographic substudy using ultrasound to look at the heart revealed that semaglutide led to favorable changes in the heart's actual structure and function. This is known as cardiac remodeling. It suggests semaglutide may be a, quote, disease-modifying therapy, one that addresses the root cause of this type of heart failure, rather than just masking its symptoms. So if it's not just about weight loss, how exactly is semaglutide protecting the heart? The answer is complex and multifaceted, involving a combination of indirect and direct effects. Let's start with the indirect, or metabolic effects. The weight loss, while not the whole story, certainly plays a role. Reducing body weight lessens the physical strain on the heart. Interestingly, the SELECT trial found that a reduction in waist circumference, a marker for visceral fat around your organs, was a stronger predictor of heart benefit than just total pounds lost. This visceral fat is metabolically active and a known driver of inflammation. Semaglutide also lowers blood pressure and improves cholesterol profiles, reducing levels of bad LDL cholesterol and triglycerides. These are all established pathways to a healthier heart. But the real magic lies in the drug's direct effects on the cardiovascular system. GLP-1 receptors, the targets for semaglutide, aren't just in your pancreas and brain. They are found all over your body, including on the cells of your heart and blood vessels. This gives the drug a direct line of communication. One of the most important direct mechanisms is its powerful anti-inflammatory action. We now know that chronic, low-grade inflammation is a key culprit in atherosclerosis, the process where plaque builds up in your arteries. Semaglutide has been shown to dramatically reduce levels of high-sensitivity C-reactive protein, or hsCRP, a major marker of systemic inflammation. In the SELECT trial, hsCRP levels dropped by 38%. This anti-inflammatory effect was seen even in patients who didn't lose much weight, proving it's a direct action of the drug. Next, semaglutide improves endothelial function. The endothelium is the thin, single-cell layer lining the inside of all your blood vessels. It's a critical gatekeeper for cardiovascular health. When it's dysfunctional, you get stiffness, inflammation, and plaque buildup. Semaglutide appears to activate the GLP-1 receptors on these endothelial cells, reducing oxidative stress and helping to keep blood vessels flexible and healthy. Finally, as the STEP-HFpEF trial suggested, semaglutide directly promotes favorable cardiac remodeling. Animal studies show it can reduce the thickening and scarring of the heart muscle, in part by optimizing how the heart uses energy. It seems to reprogram the heart muscle to be more efficient and resilient. So what does all this mean for the future of medicine? The implications are enormous. First, the SELECT trial has blown the doors open for who can benefit from this drug. By proving its worth in patients without diabetes, semaglutide is now established as a true cardiovascular risk reduction therapy. Major medical bodies, like the American College of Cardiology, are already recommending that drugs like semaglutide be considered a first-line treatment for eligible patients with heart disease and obesity. This is also forcing a paradigm shift in how we view obesity itself. For too long, it has been dismissed as a lifestyle choice rather than a complex medical condition. The SELECT trial provides undeniable evidence that treating the biology of obesity with effective pharmacotherapy can prevent heart attacks, strokes, and death. It solidifies obesity as a primary target for cardiovascular risk reduction. And for patients with that difficult-to-treat heart failure, HFpEF, semaglutide offers newfound hope, improving not just symptoms but potentially the underlying disease process itself. The journey of semaglutide is a remarkable story of scientific discovery. What began as a tool for managing blood sugar has transformed into a weight loss phenomenon and has now revealed itself to be a formidable weapon in the fight against heart disease. Its multifaceted attack, reducing weight, inflammation, blood pressure, and directly improving heart and vessel function, makes it a game changer. As research continues to peel back the layers of its complex benefits, semaglutide is cementing its place as an essential part of our strategy for preventing and treating the world's #1 killer. The era of treating obesity to save the heart has truly begun, and semaglutide is leading the charge.